Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. It is Friday morning, and you know what this means. It is time for Friday Friends, where I, the Executive Director of RI Elder Info, bring information and resources that you or someone you know needs to know about. And today's conversation is incredibly important that people really pay attention. So please share, get the word out, because this is something that is impacting a lot of Rhode Islanders, and it's really important that they get the information and have accurate information regarding Medicaid as soon as possible. So please help me get the word out. And when we talk about getting help, I cannot forget to say thank you to our sponsors for their help in allowing us to bring us this show to you. So a big thank you to Point 32 Health Foundation, who has just joined the RI Elder Info family, and to Aetna, United Health, Oak Street Health, Neighborhood Health. And for the month of March, we are super grateful for the sponsorship from the Ocean State Center for Independent Living. Here's a word from OSIL about their wonderful programs.
Did you know that smart home technology may help you live more independently? People with disabilities may apply for smart home technology through Ocean State Center for Independent Living's Smart Home Technology program. Devices include smart locks, video doorbells, alerting systems, smart bulbs, and smart hubs, and 2 months of connectivity. You must be a Rhode Island resident with a disability and fall within this program's financial guidelines. For more information, call us at 401-738-1013 or contact us by email at info@osil.org.
OSIL is a great program, folks. I really hope you reach out to them because they can help. So this week, I am speaking with Acting Secretary of the Executive Office of Health and Human Services, Anna Novais. Hi, Anna. How are you?
Good morning. How are you? I'm good. Thank you so much for having me here.
Oh, I appreciate you coming on. I understand that there's some big changes coming for Medicaid and what people need to do. So I'm hoping you might be able to let us know what the Executive Office of Health and Human Services does and what these changes are for Medicaid.
Oh, absolutely. So again, thank you so much for having us here. The Executive Office of Health and Human Services, as we call it, EOHHS, easier to say. We oversee all of the health and human services agencies. So that includes Medicaid, that includes the Department of Human Services, includes the Department of Health, includes DCYF, Department of Youth, Family and Children, includes the Office of Healthy Aging, includes the Office of Veterans Affairs. So it's really, and behavioral health, BHDDH, our behavioral health and hospital system, and children with disabilities and families and adults. And so it covers indeed the whole gamut of health and human services. And right now, more than ever, we see how much our families need the support and the services that we bring. It is important. This is a big change because when you think about the Medicaid process, people were used before the pandemic. You apply, you get your benefits, and then every year you need to reapply and renew your benefits, update your information. Those were normal processes that folks were used to do. But since the beginning of the pandemic, and when the pandemic started, at the federal level, the national government allowed states the flexibility not to need to do that. And so people have not renewed their information, have not need to renew to reapply for their benefits since 2020, when we had the declaration for the pandemic. So that is a long time. It's almost 3 years now for some folks. So those are processes that one forgets to do. And that's why it's
And so when COVID hit, it seemed like there were more people who maybe became eligible for Medicaid services. Is there anything about that that will change now that the pandemic is, I don't want to say winding down because I think COVID will always be with us, but some of these programs are winding down. So those folks who maybe were eligible during the pandemic, are there some folks who may lose their eligibility?
I mean, right now we are looking only financially
Okay.
determination and eligibility, so we're not looking at the rest of it. And the changes that we're talking about, they apply only to Medicaid. People have received other benefits. They may change with the end of the pandemic. That's going to happen in May 11. That may change. Some of the benefits are going to go away or change, as you mentioned. But right now, what we're talking about, it's only applied to their health insurance benefits through Medicaid. And it's only looking at the financial eligibility. That's the process that we're going to go through. That's why it's important at this moment that people, before we start doing that, and we're going to start doing it April 1st, people have time to update their information. That's the most important thing that anyone can do. It's go into the portal that we have, and there's the web page. It's the healthyroad.ri.gov. And it's a web page that they can update their information. They go in, they click, they can put their name, their address, their phone number, email addresses, they have one, mailing address. That allows us to have update information for everyone that is currently enrolled, and that will facilitate tremendously the process. We expect that many of the folks who are going to be going through the process is going to be what we call a passive renewal, meaning they're going to get a package. If there's no change in their circumstances, if their information has been updated, they will go through without an issue. Most of our elderly people with disabilities, that's the expectation. And the other ones, they may need to, if they haven't updated their information, they may need to get more information and so forth. So that's really the best way. The other way for them to also update their information outside of the number to call Health Source RI and talk to folks, the healthyroad.ri.gov. Thank you for showing it. It's truly appreciated. Also, for those who are part of the managed care, have a managed care insurance card, like the ones who are part of neighborhood, folks who are part of the United Community Plan, they can also contact their number, looking at the back of their cards, and update their information through the managed care company to their insurance. That will also work. So there are multiple ways that folks can update their information, and that's the most important thing to do right now.
So for folks who are able, they can log on to healthyroad.ri.gov, and we had that up on the screen. And when that screen pops up, over on the top right-hand side, there's a button that says log in, and then a screen comes that gives some information, and you hit accept, and then it brings you to the login information, and that allows everybody to be able to log into their account and update any information necessary. I'm assuming you can do that on a computer and a phone, if you have a smartphone or a tablet. What kinds of information should people have available? What kind of questions will they be asked that they should prepare ahead of time to make sure they have the information to answer the questions?
They need to have only their name, which I'm assuming everybody knows. They need to have their mailing address. If they change addresses, they need to confirm their phone number. They need to update their email address if they have one, or give us a new one. So right now, that's the only information that folks are going to be asked for, nothing else. Then, as of April, they will receive the package that, if they are old members of Medicaid, they will remember. if they applied for the first time during COVID, it's going to be the first time they receive that package. It's called the recertification package. It's a 21-page package. And so there will be kind of two things. Either they get it and they have nothing to do because their information is all updated and correct, and we'll say to them, you're going to be passive renewed, or they're going to be getting a package with a request for more information that will be for folks that we need anything different because they are a special population or so forth. That's how it's going to work. And we are ready to engage with folks throughout the process. So we'll send the notice April 1st. If we have not received it by, like, suppose 3 weeks have passed, 4 weeks have passed, and we see the deadline approaching, we're going to send folks another notice saying, hey, I'm waiting for your information. I haven't received it. When we receive information, we're going to send another notice saying, I got your information. You're good. We want to make sure that people are informed throughout the process so people don't feel anxious needing to say what's happening. We want as much as possible proactively to inform people. And I think that's why it's so important that we have the conversation we're having right now, but not just one time. We are going to need, this is big. We're talking about 330,000 K plus people. So it's 1/3 of the state that's going to go through this process. It's not going to be done in 1 month. So I also want to say that very clearly. We have 14 months to go through this process. So every month we will send the notice to one slice of the whole population. And those are the people who are going to be getting. And if you did not receive, you do not need to be concerned. We are making sure that we are creating ways also in our portal where people will be able to see when are they going to be due to be recertified, so they will know when to expect to get the package. We also are going to be asking folks like you, so again, thank you so much for bringing us here, but other community partners that work with the population that we're serving to help us sharing that information. So we are developing a toolkit that we're going to share with every community partner so they can support in spreading the message and working with people and letting folks know, yes, this is a renewal, but we have a process in place. It's going to be hopefully smooth process for everyone, and we are going to keep engaging. I know many people say, does this apply to my SNAP benefits? Does this apply for my Rhode Island Works benefits? No, it doesn't at this moment. The only thing that it's being renewed, it's the Medicaid insurance benefits. That applies only to that.
And that kind of is like, that makes sense to me, because during COVID, a lot of people lost their jobs. A lot of economic situations have changed. So people were eligible for the Medicaid benefit because we really needed to ensure that folks had access to the healthcare necessary that COVID really drove the bus on. So many people got sick here in Rhode Island. Now, one of the groups that was disproportionately impacted by COVID were individuals in the lower socioeconomic status, as well as individuals who maybe don't have English as their first language or have different countries of origin. Will these recertification packages and the 1-855-840-4774 phone number, will the information be available in other languages? And who will be able to assist if someone perhaps doesn't have a high degree of literacy? Who can help?
So I think everybody can help. We can help. Some of our community-based organizations can help. Folks can and should go to the offices, the EOHHS offices, if they need specific assistance. That's always there and available. And so the other the other thing regarding the notices, they are being all translated in multiple languages. People will get the information in multiple languages. And the numbers, they do have possible access to translators and interpreter services. So we are looking at all of those populations as more at-risk populations. So we are available in other languages. We are reaching out to community-based organizations and providing them support so they can help with the outreach, with the education, with the reaching out to the families. We are asking every single state agency that has a frontline staff that is interacting with folks to be our messenger in this process. So if a family goes to the WIC office, the WIC office can help them. For example, if someone receives home visiting services, that home visiting agency has the information and can help them. If someone is with the CYF, we are reaching out specifically for the CYF to make sure that the CYF process with children is a little different, are taken care of. We know folks who are in SSI and are renewed through Medicaid, they are going to be renewed in a different process, but we are aware of it and that information is being shared. So we are really identifying every single, I don't want to call it special population, but more vulnerable populations to make sure that we support. An important thing to say also is, for example, families with children, they don't need to be concerned right now. We have them scheduled to be renewed later in the year. It's going to be in January, in fact, of 2024, that they will be starting that renewal process for any family that has children. So we are spacing out and doing it in a way that creates the least amount of disruption to the people. And we are trying to make sure that people don't hear from just us. They hear from us, they hear from trusted partners in the community, they hear from other trusted partners within state government, and together we can make sure that we limit the amount of anxiety that exists. And that's the only way to do it. It's together.
You know, at RI Elder Info, we're all about working together to be able to reach all Rhode Islanders. But, you know, a lot of times we have situations where, you know, my neighbor got their paperwork for recertification, but I didn't get mine. And so that is to be expected. That's normal, right? Because you're not trying to send a mailing out to a third of the population of Rhode Island all in 1 week, right?
Yeah. In fact, we're going to be sending one notice to 1/3 of that population in 1 week to let them know that this is happening. We want everyone to know that this is happening directly, hear from us, but also letting them know what to expect, what's next. So people would know what to expect. As they get that notice, the notice would say, for example, do not wait until you get a package before you take any action. If you haven't done so already, go and update your information. So it explains everything step by step, so people would not get anxious when the neighbor gets a package and they don't get one. We will tell, if you are an elder person or a disabled person, you're going to be renewed passively. You don't have to take any action. You're going to get a notice of a package that says you're good, kind of thing. And so those are all of the steps. I also know that folks, many people are asking, for example, and what happens if indeed after we do the review, we get the package, we get the information, and someone is no longer eligible for Medicaid? What's next? Even for that, we are having plans in place. People who would be no longer eligible for Medicaid, but classify under because of income, they will be enrolled, automatically enrolled if they qualify, automatically enrolled under a plan by Health Source RI. We have that process in place. We worked with Health Source RI so that enrollment is automatic when they qualify based on their income. And we are also the state, we are so grateful to the administration and to the legislators because we are being able to offer for 2 months, we'll pay the premiums. Because people don't pay premiums in Medicaid. And so we want to make sure that that is that transition so people don't feel the impact immediately. So for 2 months, their premiums will be paid. So we are trying our best by sharing information, by putting the processes in place, by training the staff at the state agencies to share information, retrain the staff on these processes because themselves they haven't done it for a long time, making sure that our community partners know the information, and being available to anyone who wants to talk to us. We will show up and we will explain as many times as necessary. So we go through the process of doing this redetermination for 300,000 plus people, 1/3 of the state, in the best way possible.
That is amazing. It sounds like it's a huge effort, but with all things, many hands make the load light.
Absolutely.
When
we're not on it alone. There is us, EOHHS, DHS, Health Source RI, Medicaid program. All of the staff has been working together and putting this plan in place since last year. We've been getting ready.
Awesome. And when people receive that package and have to return information back, how is that information being kept safe and secure and private so that people's personal information doesn't get into hands of troublemakers?
Oh, I know. And it's so concerning nowadays. I know how important that is, but our systems are very secure. When people send back their information, it being by mail, update their information on the portal is totally secure. But I think it's important to remind people that first, there is no charge to do none of these. So if they get phone calls saying, oh, you need to do this and it costs X, that is not, that will be fraud. It's not coming from us. Any phone call that they're gonna receive from us will be identified as coming from us, so they shouldn't be there. And there are numbers that people will be able to call if they suspect that they got like a scam or something like that. So the numbers, there's an online an Office of Internal Audit fraud complaint form that they can fill out. They can call, and maybe I can put that number on the chat, but they can call. It's 401-574-8175. That's a fraud unit, or they can send it by mail, and there's also a mailing address that they can send if they suspect that there is a fraud or that they were victims of a scam. But they should.
And so that number again was 401-574-8175?
75, yes.
Okay. And if, say, for instance, there are folks out there who get their mail from the mailbox and throw it on the pile on the kitchen table and they forget to look at it, will there be reminders sent out saying, hey, we need your paperwork back?
Absolutely. So we will send folks, everyone who gets their package, that we expect them to fill out and send more information. They will get a notice saying, hey, we sent you a package. We have not received that package back. We are also going to be communicating with people through a variety of channels, from text messages to mailing to phone calls. We are going to be doing that. If even after sending that notice, time lapse and it's the end of the time and people would be terminated, we have a mandate by the feds to attempt at least a minimum of 2 times and 2 different ways of communication to reach out to people. We are committed to do it more than those 2 times, to make sure that we are doing our best to hear back from folks. And once, let's suppose we exhausted everything and people do get a notice of termination by lack of contact, there's still a 15-day window. They will get an appeal form along with that information that says, you know what, you still can appeal. So we are doing our best to make sure that people have the time, the opportunity, the means to update their information, to give us what we need. So if eligible, their benefits will be maintained.
Wow. So I just want to make sure that we've got all of the information. It is incredibly important that anybody receiving benefits go on healthyroad.ri.gov, go in the top right-hand corner, hit the login button, and update their information. So when the recertification packages start getting mailed out in April, that it gets mailed to the right person. But not everybody is going to get their packages all at the same time. So I might get mine today, my neighbor might get one next month, and that's perfectly normal.
Absolutely.
Okay.
We have 12 months to do all of these, plus 2 to pick up someone we may have missed. And just to reiterate, they can contact their managed care organization. That's a way to do that. They can do the example of that you just did, the healthyroad.ri.gov. healthsourceri.com, they have a live web chat, so they can chat with people through the healthsourceri.com. Then they can call HealthSourceRI at the number that you put in there. And definitely staff are available at DHS local offices, and they can assist a limited number of clients. They can assist customers. We are here ready to help people to go through this process.
And if people want to talk to a real live human being and not go online, then they can call the 1-855-840-4774, and the information will be available in multiple languages.
For sure, they can assist in English and Spanish at that number. It's Monday through Friday, except holidays, 8 a.m. to 6 p.m. There will be a live person to talk to them. They can go to a DHS office in limited capacity, but they can go to a DHS office if they want to talk to someone. Absolutely.
Awesome. Is there anything else that we didn't talk about that people need to know about this upcoming update to the Medicaid program?
Not that we haven't talked about, but worth reiterating. The best thing that people can do right now is make sure that Medicaid has their up-to-date contact information. That's the most important thing for folks to do. Their name, mailing address, phone number, email address, the most important thing. And
Awesome.
that needs to be done now.
Right now. All right.
And throughout the month until April 1st, that's the most important thing.
Oh, good. Okay. I think we've got it. And hopefully, those folks watching, if they are with a community-based organization, if they're a resident service coordinator, if they're with the senior centers, I'm sure that they can reach out and have presentations done or get the information that they need, the training they need to better help their clients, correct?
Absolutely. We will go, reach out to us. We will go, we will talk. We have a community advisory, in fact, a group that we pull together of the stakeholders. We meet with them on a monthly basis. We started in January. We're going to have monthly meetings to make sure that throughout this process, we keep our community partners informed, but we also hear from our community partners what's happening at the community level, what are people saying, what are people not understanding, so we can adjust as we go along. April 1st, it's the start of a 14-month process. And so we have 14 months to do this with you all, and we appreciate all of the support. And so we look forward to continue to engage. Maybe we'll come back after we start to say, hey, it's going well. Oh, some challenges that we need to address.
You are welcome to come back anytime, Secretary. I appreciate you coming on today and taking the time out of your really busy schedule to help get the word out. I appreciate it.
Oh, this is important. So I appreciate you for inviting us. Absolutely. Always available for anything that's needed.
Thank you.
Thank you.
Everybody, these are big changes that are coming, so it's really important that you get your information updated. If you rewind a bit in the show, you can see on the screen exactly what the website's going to look like and exactly how to get to your login information. You can also call the 1-855-840-4774 number for help. And please, please know there is no charge. If somebody is calling you to say, give me your credit card information and I'll help you with the paperwork, it's a scam. Don't fall for it. Help is available for free. Just reach out. It's super important that you get your information updated this month. The mailings are going to start in April. They're going to come out a little bit at a time over the next few months. So don't panic if you didn't get yours right away, but you want to make sure that you have the most up-to-date information in the system. So I look forward to seeing you all again next week. In the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.